and welcome to Standard Precautions and Beyond, Conversations in Infection Prevention and Control, a podcast of the Alabama Regional Center for Infection Prevention and Control, Training and Technical Assistance, or ARC-IPC. My name is Mina Napavi, and I'm a program manager with the ARC-IPC at the University of Alabama at Birmingham School of Public Health. It's August, and it's not just kids back in class. School is now in session for germs, viruses, and bacteria that cause illnesses that can make your child, or yourself as a parent, caregiver, or guardian, sick. Back to school is widely recognized in the medical community as a time when many children pick up infections from their classmates. As a parent or caregiver, what do you need to watch out for? Dr. David Kimberlin, professor and co-director of the Division of Pediatric Infectious Diseases at the University of Alabama at Birmingham, is joining us today on the podcast to discuss some common illnesses found in schools, the best way to treat them, and the importance of good hygiene practices to reduce the chances of catching these illnesses. So thank you for joining me, Dr. Kimberlin.
Well, thank you, Mina. I appreciate the chance to be here.
We're so glad that you were able to join us again to talk about some of these common illnesses that are seen in children as a way to prepare for back to school time. I thought that we could spend the first half of this podcast talking about a couple of illnesses, what they are, how they're transmitted, how they're treated, how long children should stay home when they're sick. And then towards the end of the podcast, talk about good hygiene practices to keep our kids as safe and healthy as possible. Does that sound good?
It sounds wonderful to talk about common things again after so many years of pandemic.
So to get us started, just a general question, why does it always seem that kids get sick when they start back to school?
I think it's because kids get sick when they start back to school. It's an observation that parents have had for decades, probably hundreds of years, and it's just a simple fact. When you've had children who have been apart during the course of a summer and all of a sudden they're coming back into a school setting, an enclosed building, weather's beginning to change, they're around a lot more people, children can kind of be cesspools for viruses and bacteria, and it tends to spread from one person to the next. And so I think that clearly over many, many seasons now, we've been able to see, with the one exception of in the middle of the pandemic, that was a very unusual circumstance where we did not see a lot of spread of regular routine viruses and bacteria among people. Other than that, what we see and what's reproducible in the literature is that when kids go back to school, they're going to get sick. And then oftentimes they can bring that sickness, that illness back to their parents or to their grandparents or to other siblings who aren't yet of school age.
Absolutely. So I know we were going to talk about common illnesses, but I want to kind of kick off and talk about COVID to start with, because I think that's been on everyone's mind for the past few years. So can you start off with that?
Yeah, it's the 800-pound gorilla still, right. Isn't it? COVID is not going away. Now, thankfully, it is changing. I mean, I think we're recording this in August of 2022, and undoubtedly we're in a better place than we were 8 months ago, 7 months ago, certainly a year ago. A year ago, we hadn't even seen the Delta wave yet, much less the Omicron wave. So where we are right now that makes it so much more manageable is a couple of things. Number one, the amount of immunity in people around the country, around our local communities, around our state, is simply higher than it was. I hope a lot of that is from vaccine. I mean, that's by far the safest way to develop immunity against this still life-threatening virus. A lot of people, though, are not embracing getting the vaccine. I don't fully understand that at all. In fact, I would say I don't understand that at all. But it is a reality. And even for some of those that do get vaccinated, this is such a transmissible virus that people can still get infected. And so there's, a study not long ago from the American Academy of Pediatrics and the CDC that showed that 75% of children had immunity to COVID, and most of those actually were not even of an age where they could have gotten vaccinated at that particular time when the study was being conducted. And that changes things. That means that we have a population that is not at the same degree of risk as it was back in 2020, before we had vaccination, before we had the opportunity for people to become exposed to and infected by this virus. In addition, the virus has changed. The virus has gotten where it stays more in the upper part of the airway and is less likely to go to the lower part of the airway. And as a consequence of that, it tends to, in the individual person, be less severe. Now, that's not to say it's always less severe. We still have, hundreds of people dying every single day of COVID. Thankfully, not many of them are children. But COVID, over the course of the pandemic, has been, number 7 or number 8 in mortality, causes of mortality in children. So even though, thank God, it's unusual for a child to die, when they do die, it's one of the more common reasons for it. So I think right now we should celebrate where we are. We should protect ourselves. We'll talk about that some with the general hygiene kind of conversation that we'll have in just a bit. And then we also should embrace, what science has given us, and that it's these incredibly effective and safe vaccines. And so if a parent's listening to this and their child or their adolescent has not been fully immunized, and that now means, getting the vaccine and getting a booster, at least one booster, depending on your circumstance, they should do so. That's the best way to protect yourself and to protect your family.
Let's switch gears a little bit and talk about the common cold. So kind of what do those symptoms look like? What should parents do if their child does have those symptoms? What's your recommendation?
Well, it's a good thing that we're able to talk about the common cold again. Back in 2020, we did not see much we did continue to see rhinoviruses, but enteroviruses, which also can cause the common cold, they just disappeared. Respiratory syncytial virus disappeared. Flu disappeared. So in many ways, that is our answer in terms of what we can do. Now, I'm not saying we go into quarantine and lockdown, for a common cold, but it does give insights in terms of what we as a population, if we put our mind to it, what we can do to really significantly modify the way that these viruses are spread among us, between us, from one person to the next. Colds everybody knows what a cold is because everybody's had many, many colds. Right. It's runny nose, it's sore throat, it's congestion, nasal congestion, cough. Most of the time, overwhelming majority of the time, it's a perfectly, uncomfortable period, but a completely benign period. And most of that is because of the nature of the way we have gotten acclimated to these viruses, and the viruses have gotten acclimated to us over thousands and thousands, probably millions of years. Colds are caused by either, I've already mentioned, rhinoviruses or enteroviruses. The rhinos are the one that are the most common. And they really survive much better in the upper part of the airway where it's not as hot. By the time they get down into the lungs and they're surrounded by 98.3 degree temperatures, they don't do as well unless you're immunocompromised. It can cause pretty bad lung disease if you have a weakened immune system. But that isn't where, the overwhelming majority of us are. Right. And so the thing you do for it is treat it symptomatically. If you have a sore throat, suck on a lozenge. If you're over 6 years of age, decongestants can be used. It's interesting that the studies have shown consistently that under 6 years of age, decongestants don't really work that well, and they can have some more severe side effects, heart racing and things like that, because they basically kind of speed. They're kind of like amphetamine in a way. It kind of speeds you up. By doing that, it also shrinks the blood vessels in the nose, which is why your congestion goes away. Right. So it's symptomatic treatment. If you're running fever, you should not go to school. But for the most part, if you have a common cold, and you're able to participate in activities and so forth, you're generally not going to need to stay home.
Now, you mentioned this when you were talking about the common cold, RSV, and I know you typically hear about that in infants, toddlers, but is that something that school-age children can pick up from their siblings?
It is. Respiratory syncytial virus is a different virus from the rhinoviruses and the enteroviruses. In many ways, it kind of behaves more like what we now know so well about the coronaviruses. You don't get RSV once and then have lifelong immunity. Instead, you get RSV over and over and over throughout your lifetime. All of us do. Right. And so it's a kind of virus that we need to be mindful of. You mentioned toddlers and infants. The reason we're so aware of it in those patients is because when they get the congestion and they get, kind of some phlegm and stuff in their airways are smaller. And so they can get plugged up and they get this, the bronchiolitis, the wheezing, that thing that is so scary for parents, and understandably so. And, sometimes they have to come in the hospital and spend a few days in the hospital getting oxygen and being suctioned. Sometimes they can't eat very well because their nose is so stopped up. These are the younger children I'm talking about. But by the time you get to 2 years of age and over, generally speaking, your airways are bigger because you yourself are bigger. And so then if you get RSV, or if you're an adult and get RSV, a non-elderly adult getting RSV, it's generally just a really bad cold. It tends to be quite a bit more severe than the common cold that we talked about already.
Gotcha.
Now, interestingly, with RSV, I know we're talking back to school here and everything, but it is increasingly recognized as probably even worse in older adults compared with young children. The disease burden is way high in people who are, 70, 80 years of age. And there's a lot of developments in vaccine assessments to develop and hopefully have available to us within just a handful of years a vaccine that can be used to protect children against RSV and also protect the elderly against RSV by vaccinating them so that they don't get as sick, maybe vaccinating pregnant women so that they pass along immunity for those crucial first several months to their baby, so the baby's protected after they're born. There's a lot of different ways that we're looking at that.
Well, that's very exciting to hear.
It is. There was an RSV vaccine back in the 1960s that not only didn't work, it actually made things worse.
Oh my goodness!
And that set things back for 50 years.
Wow.
But we know so much more about vaccine technology now than we did 50 years ago.
Right.
And again, that puts us in a good place.
Excellent. Let's talk about the flu, because I know that's flu season is coming up. What do parents need to look out for there?
Well, influenza is another one that's been around forever. And the symptoms there generally have a lot of fever, body aches, respiratory symptoms, headache can go along with that. And the good news with flu is you can prevent it by getting the flu vaccine. Now, the flu vaccine is not as beneficial for protecting against flu as the COVID vaccine is for protecting against COVID, but it still is usually about 50% effective. And my analogy is, look, if I'm going into battle and I have the chance to put body armor on half of my body to protect myself, would I do that, or would I just say, it's only half my body, I'm not going to wear any body armor?
Right,
of course, you're gonna protect yourself to the extent you can. So if you're 6 months and over, everybody should be vaccinated against flu every single year, and it has to be every year because the virus changes from season to season. We also have antivirals that are, approved down to 2 weeks of age, even with some studies that we actually ran here at UAB. Was the foundation for decreasing the approval for Tamiflu down below a year of age. It's a virus that can cause a lot of problems, but it is treatable and ideally, it's preventable.
And I know there's a lot of discussion about when to get the vaccine. What's the best time to get your children vaccinated?
For children, it's when you have access to the vaccine.
Okay.
So if it's August, September, and the vaccine's available, go ahead and get it. There are data that suggests that in adults, you might want to try to time it a little bit more, where you might get it, say, in November, in anticipation of a January flu season. The problem there is we don't know when the flu season's going to be. And so you're kind of rolling the dice. But with children, you don't even have to do that. The data just haven't shown that it's that critical. So if you're a parent, when the vaccine is available at, your local pharmacy or your doctor's office, that would be the time to go ahead and make the appointment to get it.
As soon as possible. Talk about strep throat. And I wonder if you could differentiate for our listeners the difference between, having a sore throat and strep throat. What's the difference between the two?
Well, strep throat is caused by a bacteria called Group A strep, or Group A streptococcus. And so it's different than what we've talked about so far. What we've been talking about so far are viruses. Bacteria can be killed by antibiotics. Viruses are not killed by antibiotics. They can be killed by antivirals if you have an antiviral against that particular virus. So with strep throat, it's a bacteria that a lot of us can even carry just in the back of our, back in our throat. But when it starts causing problems, the problems that it will cause is a really sore throat. Now, a standard cold can cause a really sore throat. A COVID can cause a really sore throat. Allergies can cause a really sore throat. So simply because you have a sore throat doesn't mean it's strep. But as parents know, or for either from themselves or when they take their children in, when they go to see the doctor, one of the first things they do is swab the back of the throat to see if it is strep. Because if it is, you can give an antibiotic, and within 12 to 24 hours, it will start making the child feel better.
Now, to switch things up completely, pink eye. I know that's something that you can see in daycares or elementary schools. Can you talk a bit about that?
Pink eye is aptly named. It's a pink eye, and it can be caused either by viruses or by bacteria. The bacteria that cause it are the kind of bacteria that generally live in our noses and our throats. And if they get into the eye, they can cause this localized bacterial infection. And then viruses as well can do it. And it's a whole range of different viruses or even bacteria that can do this. And so it's a manageable illness. It looks kind of horrid. We all remember Costa, or whatever his name was, with the Olympics, when he was broadcasting with that horrible-looking eye.
That's right, yes.
But it's irritating and it's painful, but it is not dangerous. It will not affect your vision. And as long as there's not excessive tearing or things like that, children can go to school with it. The main thing there is hands touching the virus or bacteria and then touching your eye. Or if you have pink eye, touching your eye and then touching a surface, and someone else touches the surface and then touches their own eye. And that's how it spreads from person to person.
Well, and that leads in great to the second half of this podcast, where I want to talk about these good hygiene practices to reduce the chances of infections. So let's talk first, washing hands often. So just really important.
Yes.
All the time. To prevent all of these.
and that's not to say, you have to wash your hands every 40 seconds. But undoubtedly, again, we are all now, and to some extent, infectious disease experts,
yes.
After the last 3 years. And what we know is that if you wash your hands, and you're mindful of what you're touching, the surfaces that you're touching. If you are, like right now, I have on the table that's between us as we're talking, my hands are sitting on this table, and there could be germs on the table. On the other hand, I'm not going to be taking my hand and putting it up to my eye or to my nose or to my mouth until I wash them. And so just being mindful of that, I think, is not paranoid about it, but mindful about it, I think is really the best way to realize that hand hygiene matters. We've known it in the hospital setting for millennia or for hundreds of years anyway. Right. And now we are more aware of that as a society, I think.
And as parents or caregivers, we need to model that behavior in front of our children, just.
I think you're exactly right. And the other thing, though, is let your children model it to you. I do a germ talk to a kindergarten class and have ever since my daughter was in kindergarten, and she's now a rising senior in college. So it's been a lot of years, except for 2020. I did do it in 2020, right before the lockdown. It was 2021 that I had to do it remotely. But I go in person and I talk to these kindergartners about germs. And of course, they know a lot about germs now. But even before the pandemic, they knew to sing happy birthday or count to 20 when they're washing their hands. They knew about coughing into their elbow. They know these things.
Right. Like
many things, if we behaved more like children and less like sometimes we're capable of, I think the world would be a better place.
Excellent. My next point was avoiding unnecessary contact with a lot of people, or avoiding large crowds as much as possible.
That's a tough one. I believe that a big part the biggest part, obviously, from the pandemic, coming out of the pandemic, that's moved us to where we are now is the availability of the vaccines, people getting the vaccines, the virus is getting somewhat weaker, people having more disease-induced immunity or vaccine-induced immunity. That's the biggest thing. But hand washing has played an important role. Masking has played an important role. Social distancing, to your point with this question, has played an important role. CDC, as part of this recent set of recommendations last week, they dropped that 6 feet recommendation, which I think is probably right. But I do think we need to be aware that when we are right up next to each other in large groups, we are putting ourselves at greater risk than if we're not. Now, you also have risks if you are isolated in your home and you never see anybody. And that we have learned the hard way over these last 3 years.
Right.
So we are social creatures. We need to be around each other. But do be aware that if like if I'm in an airport, for example, I'm going to try to kind of hang out by myself and not, crammed in with everyone else. I'll go to the gate, when they say come on in, not just kind of to hang cramped together there.
Right.
That's just kind of a safe way to do it.
And I guess that's even more important if you are sick. So kind of limiting your exposure to other people as much as possible.
I think you're exactly right about that. And I think that that's another aspect of the pandemic that I hope stays with us. What we did in 2020 for each other, for the most part, was really beautiful.
Yeah.
People in the middle part of the country, when they weren't seeing COVID yet, they were still taking those precautions because ultimately we are all our brother's keeper, our neighbor's keeper.
The next point was about teaching your children cough etiquette. And I know you said you see that in the kindergarten classes where you go in and teach about germs. Just about coughing into your elbow or coughing into a Kleenex or something like that. So
yeah, be mindful that when you cough or certainly when you sneeze, there's an awful lot that comes spewing out of your mouth. And thankfully we don't see it. That'd be kind of gross. But if you do, you can go look in slow motion on YouTube, and it'll be.
It's a lot of stuff, yes.
And so what I think we need to be mindful of there is that if we have infection-causing germs in our mouths and we cough, that germ will be, out in the environment. And so the way you want to try to avoid that is if you're wearing a mask, that'll help block it. Most of us won't be wearing masks as much in the future, hopefully. But you then think about, let's cough into your arm. If you do cough into your hand, even if it's a tissue held in your hand, good to wash your hand right after that.
Sounds good. And finally, the importance of cleaning surfaces and I guess highly touched surfaces, doorknobs, different handles, tables, those sorts of things.
One of the, we talked about rhinoviruses already, and I mentioned that even during the pandemic, depth of the pandemic in 2020, we did not see decreases in circulating rhinoviruses. The thought is that they stay on surfaces better. We didn't know about COVID at the time. We were very worried about surfaces at the beginning. I think in retrospect, now that we know as much as we do, I don't think we necessarily had to be as concerned about surfaces for COVID. And we don't have to be as mindful of it for some of the other viruses as well. But rhinoviruses especially can live really long periods of time on a surface. And if you're touching a surface and it has a virus or even a bacteria on it, and you put it up to your mouth, to a mucous membrane, your eye, whatever, your nose, you can pick up an infection that way. I don't think we have to be germaphobes and just try to live in a sterile environment. That also can have its problems with asthma and so forth.
Right.
But do keep a clean home.
Sounds good. Do you have any other recommendations that we haven't touched on to keep our kids and us parents healthy this school year?
Yes. Wonderful news. We not only have incredible COVID vaccines, we have incredible vaccines against measles, against polio, against mumps, against rubella, against varicella, against pneumococcus, against Haemophilus influenza, against hepatitis B, against hepatitis A. I mean, the list goes on and on. Use them. A vaccine does not do any good when it's sitting in a bottle on a shelf. It only does good if it's in the person receiving the vaccine, and then their immune system can respond to it and be ready if they ever actually see the real thing as an invader. What we know right now is going on in New York with polio is scary.
Yes.
Measles will be coming back. If we let our guard down, I promise you the next podcast will be about that particular infectious disease. And we don't want that. We don't want paralyzed children in iron lungs anymore. We don't need to do that. We can avoid it. But to avoid it, it means we have to take an action. The action is to get vaccinated. If you don't get vaccinated, that also is an action. It's an act of omission that puts your child at higher risk. So please, my kind of departing comment would be, call your pediatrician or your family practice doc and say, is my child up on all their immunizations? And if the answer is yes, congratulations, you've done great. If the answer is no, then please, go in and get them caught up.
I think that's a great closing message, Dr. Kimberlin. Thank you again so much for being here today, for sharing all of this valuable information for our listeners. We appreciate it.
Delighted to do so. Thank you.
And thank you for listening. Please tune in next time for another episode of Standard Precautions and Beyond, Conversations in Infection Prevention and Control.